Thank you, Nicola, and thank you all for joining us today. Today's one of the most exciting days for me each year in terms of hearing about the work that you're all doing and we're all doing together, hearing about the impact we're having together, but also hearing new ideas be shared and grow amongst our community. Because as Nicola said, this is very much a team effort, and it's days like these that really help us to accelerate and imagine the future that we can see ahead of us. That's whether you're a researcher in academia or industry, whether you're a partner in the NHS or another organisation supporting our efforts, whether you're a policymaker or whether you're one of our participants. And our participants are at the centre of everything we do. You'll hear later in this session from Kirsty and from Adam. You'll also hear at the opening of each of our stages from our participants to share some of their perspectives on what brings them to join us. And please look out for our participants who are with us today. You'll see yellow lanyards, and also they'll be in the main atrium area downstairs where you can meet and come and have conversations. And we really value those conversations as springboards to the work that we'll all be doing in the future. This picture on the screen just reminds us of the sort of impact that we can have, and we're proud of having together with you in cancer and in rare disease. On the right is a picture of a boy called Charlie, who is another boy like Arabella, who was diagnosed following the discoveries last year of Renew syndrome. It's a really extraordinary story written in the Sunday Times. If you haven't read it, I really recommend it. It talks about the personal impact for the family of making that diagnosis and making progress for them and answering questions. And we're committed to doing better for the families with rare disease and cancer, and to do better in diagnosis and to think increasingly about therapies. We're also, in the coming years, committed to thinking about how the impact of genomics can amplify even further. We need to do more and better in rare disease and cancer. And we see the opportunity, as does the NHS, for genomics to become part of the mainstream of healthcare. Now, that's something that we've thought and talked about for years, but it's a reality that we can now see with the knowledge that we collectively have built. With the right investment to develop the right evidence and the right infrastructure, there is a potential, we and the NHS believe, for half of all genomic healthcare encounters to be informed, half of all healthcare encounters to be informed by genomics. And what we need to do is see how we can develop the necessary evidence in infrastructure to do that, so that we can improve outcomes, increasingly support prevention, and to drive innovation, so that that gap between the idea in the lab, the idea in a research study to clinic is narrowed. I'm going to highlight today some of how we've focused our efforts and how we will be focusing our efforts in the coming years to respond to that opportunity, because this isn't a job done. This is something that builds on that sustained investment, that sustained work that we all do together. And it sits behind that vision that we still hold as our vision and is shared by the NHS for genomics, which is a world where everyone can benefit from genomic healthcare. We've been reflecting, looking at that challenge, that potential in front of us, on how we refocus, how we express our mission as an organisation. And on the screen here, set out is where we see what we need to do to support all of you and to make that impact become a reality. To provide evidence and digital infrastructure so that by 2035 there is that potential for genomics to play that broader role. And by doing this, to support what the government has highlighted as important in making the NHS for the future, increasingly digital, increasingly preventative, and increasingly in the community. And if we get this right, this isn't just about that. It's about accelerating those innovations, how they arrive in clinic. So whoever you are, whether you're someone who sees the potential to discover a new gene, like that causes Renew syndrome, or that you have a new genomic sequencing technology that can be tested and proved, you have an idea of where genomics, a new clinical area, a new utility for genomics in clinic, how that might be harnessed, how you develop that evidence, how you learn and provide the evidence so that policymakers might in the future be able to make that choice, should we use genomics in that area? Or whether you're developing a new AI algorithm that you want to prove and demonstrate it actually works in clinic, or increasingly, you want to discover and prove genomic therapies or roll out genomics-enabled clinical trials. We need the infrastructure and to support it that will accelerate all of that. Over the last 12 years, we've been an organization. We've focused on how we can support you best to do that. And you'll hear today examples of all of those different areas happening. This isn't just ideas that you can write on a PowerPoint. This is the work that you are all doing already today, and that together we can accelerate in the future to change lives and to really make the UK the place to make those investments, to change the outcomes in healthcare, but also to drive inward investment in your organizations, in your companies, and to drive growth. Our role at Genomics England is to support that through the areas where we bring particular capabilities. So in building and delivering digital infrastructure that can support national scale genomics for the NHS and for researchers through the National Genomic Research Library. It's to work to support that blueprint that we've developed together to evidence and prove new genomic innovations so that that pathway is supported and eased. But it's also to recognize that this isn't just about deep science. It's not just about proving health economic value. Those are important, they're vital, but it's also about understanding what collectively we as a society, what the public and what our participants want and what they're comfortable with in terms of how their data is used. And that's why a major focus of ours is and will remain on engagement, on ethics and equity, and making sure that those questions are at the heart of the evidence that we develop and that our participants are at the center of what we do. So where are we today and where are we going? What are the things that have happened in the last year that we're most proud of and show us the direction for the future? You know, we talk about the infinity loop. Nicola has talked about how this comes to life. A few years ago, when we begun to understand how we were working as an ecosystem, we drew this representation of that link between clinical care and research. And I think it is the most valuable articulation of how this works. But sometimes when you draw things on page, you know, they look good, but they don't come to life. They don't come to reality. What we are so excited to see, and each year when we come to this summit, we see the amplification of the impact of that. This chart is a chart of the diagnostic discoveries that together we are identifying and returning to the NHS to make difference to individual patients' lives. More than 4,000 of those diagnostic discoveries. These are families who are benefiting. On the left, Charlie, in that story in the Sunday Times. Last year when we met, the RNU42 gene had just been identified. We heard from Nikki Whiffin and from Daniel Green and their groups about this extraordinary discovery that we had a sense of what it meant. In the last year, that has expanded in multiple ways. We're beginning to understand more about the condition. The families have named the condition Renew syndrome to represent what they feel from that information and knowledge that they've gained. You'll hear later today from Nikki Whiffin and from Daniel about the work that's extended this year to understand the condition better, to begin to think about how we might make more of a difference. You'll also hear from multiple groups who found other genes like it, hidden in plain sight, in bits of the genome that weren't being looked at before, for more families, other genes just like the Renew gene. These papers are just from the last few months, and it's an extraordinary acceleration building on that knowledge and linking families who've joined the National Genomic Research Library, researchers, and then back into clinic. So that now, when I'm lucky enough to sit in clinic and meet families, sometimes I cannot give them an answer early on. Sometimes it takes years and then we find one. But always I can say to families, people haven't given up, they keep looking. And that is extraordinary and powerful for them. And we also know it's not a pipe dream. This is families being helped. We're not satisfied with just making diagnoses either. And later this morning, you'll hear from June Rain, previous CEO of the MHRA, who, among other people today, will talk to you about the way we're thinking about the potential of genomics-enabled therapies. This is another area where there is a real wind of change, and the UK is uniquely placed to harness this, to be the best place to discover, to prove, and, where they're proven, to benefit from genomics-enabled therapies. And that's why we're really excited over the last year to have continued to work with the Rare Therapies Launchpad, with MHRA and other partners, to understand how we can really make our ecosystem work for that. Because this is a real opportunity that we need to grasp, and we will. In cancer, we're also thrilled by both the continued flow of diagnoses, as in rare disease, that come from supporting national scale genomics, the creation of learning within the health system, and also from the continued discoveries that flow. You'll hear on this stage later today from Serena Nick-Zeinart, for example, a couple of papers here of the sort of really fundamental scientific understanding of mutational signatures, how cancers form. But this isn't just about that understanding in cancer either. It's also about where it gets us to make a difference to improved therapies. And you'll hear, for example, from Serena about the potential for this to really make an increasing difference in genomics-enabled therapies and clinical trials in cancer. And that's another area where we're really committed to playing our role to accelerate that, so that annotation of eligibility to clinical trials isn't something that just happens in certain rarefied environments. It's easy to do, and everyone can access trials where they're eligible. The power of deep and varied data is also growing, both in cancer and rare disease, and we've been building out our data set in the National Genomic Research Library in multiple ways, bringing in other omic data sets alongside the genomic data, for example, in rare disease, and in cancer over the last few years through our multimodal cancer program, bringing in also image data from pathology slides and from radiology images. And that's one of the areas where we're seeing the most incredible uses of AI and machine learning to really begin to either identify signatures that haven't been seen before, that we just couldn't access before, but also increasingly to think about how that might in the future be used to stratify care, to think about trial eligibility. Real excitement there. And you put this all together, and this is why in cancer also, that same pattern, the UK is uniquely placed to be the place to come to discover, to prove your innovations, and to benefit from them when they're proven. Towards the end of the day, again on this stage, you'll hear from the co-founders of BioNTech, who recognized the value of the UK as a place to test cancer vaccines using genomic sequencing to run trials and to understand how that new area of technology could expand for them. So a few years ago, they partnered with the government, with the NHS and ourselves, and this year they redoubled that investment because they can see that the UK is a place to do this, to test those technologies, and for us to benefit from them as the public and patients. So we learn a lot about where genomics is playing a role today, but we're also focused on the future. Where are those gaps in the evidence? Where are there pieces of digital infrastructure or tooling that aren't there that would be needed if we're to head towards that future that we see, where genomics can really become part of the mainstream. Genomic data could be part of the health record, something that's used and reused as we need it through our lifetime. The Generations study is one example of that, and I want to say an enormous thank you to many of you in the audience today who are part of delivering that program. It's another team effort. 30 sites now across the country recruiting to the study. As Nicholas said, more than 12,000 families have joined it. You can hear later today on the Collaborating for Impact stage from teams across the country sharing their experiences of returning the first findings, telling you about what those findings are, how we're learning as we're going through the study and developing the evidence that we'll need for the future. It's testament to the painstaking team effort that has gone on to develop the program and to continue learning so that that program can develop the evidence that policymakers will need in the future to decide whether this is something that should be offered routinely to every baby at birth. And that template builds on the experience we had through the 100,000 Genomes Project, through what we've understood through our partnership with the NHS to embed diagnostic use of genomic sequencing in routine care, but linked to research. It also helps us look to the future and to think what other questions that we should ask. Thinking about that potential across the lifetime of multiple different potential uses of genomics. As I said, this isn't just about science and looking at what the possibilities might be that are most scientifically interesting. This is about doing what will make the most difference and what the public participants would want done with their data. And that's why a major part of our work in the newborns program has been to understand the expectations of families, but also the wider public on how genomic data might be used more routinely. One of the streams of work we've been doing now, you can hear about later today, Susan Kinsella is talking on the Behind the Genes stage this afternoon about work we've done on a public dialogue to understand people's attitudes and expectations in that area. One of the areas that we see as most promising scientifically, but we also see from those conversations and from published literature, is the potential in pharmacogenomics. So the use of your DNA data to give advice on prescription, either to avoid the risk, reduce the risk of adverse drug reactions, or to choose a better and more appropriate dosing. We also see the potential for genomics through the work that we've carried out through the 100,000 Genomes Project to make a difference in adult settings where you can identify people at actionable high risk of particular diseases, where there are NHS pathways that would respond to them. That opportunity, that enthusiasm, is what's focused our efforts and led us to start to design what a program of looking at this in adults would look like, an adult population genomics program, to develop the evidence and digital infrastructure that might be necessary if we were to start to use genomics routinely in adult life. How might you design a program? What would that look like? What would the opportunity be? Thinking about those potential areas in pharmacogenomics and risk prediction. This isn't about starting from scratch in any of these areas. This is all a team effort. This is building on the expertise of people like the NHS Pharmacogenomics Network of Excellence, and you'll hear from John McDermott later today about work they've been doing to understand what pharmacogenomics can do today and tomorrow. Together, we need to build this evidence, this capability, and to keep this flywheel moving. We are uniquely placed. You can see, even through the discoveries, the stories that we can hear about today that have happened in the last year, what the potential is for us to make that difference that genomics presents. The UK is uniquely placed. And I'm really proud to stand in front of you all here today to be part of that team effort. I want to thank you for joining us today. I want to thank you for the bravery to join us on this mission, to develop that evidence. It's not always easy. People will rightly ask, are these the right questions? Are these too bold, these questions? But we need to not be satisfied with where we are today. We need to make a difference, and we have that opportunity here. And what I'm looking forward to most today is hearing about the new ideas that come from your work and from your conversations with us and with each other. Thank you very much for joining me and the team today.